farmers from reaching their fields, and food output has dropped, raising fears that a famine could set in on top of the deadly illness.
Operation has been quite intense, and we intend to scale up as the need arises. Basically, what you can see here, if you take it into any of the other affected countries, you will see also similar operations going on, and we intend to be very proactive and react instead of reactive to the situation.
Meanwhile, in Nigeria, the health minister believes the country has had some success in treating Ebola using traditional supportive care methods like those used to treat a female doctor who was the first Nigerian to contract the deadly virus.
Exactly.
However, he also mentioned that he has now ruled out the use of the experimental treatment nanosilver, but is still looking to the possibility of using other untested drugs.
And then on Saturday, early by 5 a.m., they told me, well, that it didn't pass the standards in our National Health Research Ethics Code. So I then didn't approve. So no patient has received it. But the bottom line is that we're not using it since it did not pass through the National Health Research Ethics Committee.
Nigeria is actively seeking supplies of experimental drugs from the World Health Organization and the U.S. But the United States believes that Nigeria ought to concentrate more on the spread of Ebola by laying emphasis on isolation and screening. James Entwistle reminded officials that the drug that had been administered in some cases was experimental and that there were no huge quantities of it at present.
Those are exactly what you said, experimental. And we'll see down the road what is possible, but there are not huge quantities now. And we think the focus now needs to be on exactly what you're doing. The isolation ward, screening, and especially important, and your government is doing a very good job on this, is contact tracing.
In Sierra Leone, security has also been beefed up as the country tries to enforce stringent measures put in place by the president to stop the spread of the severe Ebola outbreak. Freetown, the capital, sees a relatively low number of cases compared to severely affected cities like Kenema and Kailaon. But residents are still fearful the disease, which has spread like wildfire in the Liberian capital, Monrovia, can get a serious foothold in this city.
Initially, we have thought that the epidemic will be controlled and stopped in these two districts, Kailaon and Kenema. But it has gone beyond all of the districts in Sierra Leone. It is now in 11 out of the 12 districts. So what WFP has done is that we have stepped out our intervention beyond Kailaon and Kenema by providing quarantine family with the basic food need.
The WHO said it was working with the UN's WFP to ensure food delivery to around 1 million people living in Ebola quarantine zones, cordoned off by local security forces in a border zone of Guinea, Liberia, and Sierra Leone.
For Sierra Leone, the intention is to reach 400,000 beneficiaries because we know that the Ebola outbreak has affected the livelihood of the people of Sierra Leone. And we think that even beyond the control of the outbreak, there will be severe food shortage since farmers are unable to continue with cultivation.
While countries like Nigeria might be doing quite well in handling the spread of the virus and getting a thumbs up from the United States on how it's addressing Ebola, the newly appointed UN senior official for Ebola, Dr. David Nabarro, warns that the deadly disease was adversely impacting social structures and that fighting it would require a comprehensive support operation between different agencies.
This disease is affecting how societies work. It's affecting the social setting. It's affecting economies. It's affecting governance. It's got humanitarian consequences. It's got political repercussions. It may have security impacts. And so a really comprehensive support operation is necessary that involves all the different assets, tools, capacities in our United Nations system.
Without a doubt, the disease is impacting largely on structures But the World Health Organization doesn't believe it should impact heavily on the aviation sector, as the risk of transmission of Ebola virus during air travel remains low.
WHO is not recommending any travel restriction. When decisions are made by airline companies, they have to take into consideration their perceived risk and the real economic impact on countries that are already affected by a disease that they have to control.
However, some airlines have decided to stop flying to the affected countries. Kenya Airways, one of Africa's major airlines, has suspended flights to Liberia's capital, Monrovia, and Sierra Leone's capital, Freetown. The suspension of the flight started at midnight on Tuesday. The carrier, which is part owned by Air France KLM, flies a total of 7 times a week to the two cities through Accra. The company said it took the decision on the advice of Kenya's Ministry of Health, which is keen to prevent the importation of a case of Ebola into the country. Ebola is one of the world's most deadly diseases and kills the majority of those infected. Its symptoms include internal and external bleeding, diarrhea, and vomiting. It has killed at least 1,145 people in 4 African nations: Liberia, Sierra Leone, Guinea, and Nigeria.
And that's the world today. Thanks for watching. I am Amarat Shobani. Do stay tuned. Sports News is up next.